From the Toronto Star, I'm Adrian Chung, and this matters. Are doctors, scientists, and healthcare experts being heard? That's a question many in Ontario are asking as the third wave worsens and lockdowns continue. Throughout the pandemic, the Ontario government has been aided by the Ontario Science Advisory Table, an independent team of more than 100 scientists and health experts. They give advice to the province on best practices. They track and release the modeling data, and they use, in their words, best global evidence to help with Ontario's COVID response. But some members of the Science Table have begun openly questioning whether or not their advice is actually being listened to when it comes to policy decisions. Case in point, the Science Table's modeling, back in February, accurately suggested daily case numbers would hit 4,000 to 5,000 a day. While at the time they were projections, the province loosened restrictions. More recently, the Ontario government shut down most outdoor rec spaces, including, briefly, playgrounds. The Science Table's own writing advocates for safe and distanced outdoor activities. On This Matters, we're talking to two Toronto Star reporters, May Warren and Kenyon Wallace. They've investigated and reported on how recommendations from the Science Table have been shelved or run counter to what the province is doing. May, Kenyon, thank you for making the time to join the podcast.
Thank you so much for having us. Good to be here.
Great to be here. Thanks for having us.
So let's start by talking about the Science Advisory Table. Ontarians, of course, will be very familiar hearing about this group of health and scientific experts that have been advising the Ontario government. The Science Table has released what they would describe as essentially the do's and don'ts playbook for this stage of the pandemic, recommendations specifically on policy on how to curb the third wave. Can you take us through what kinds of measures they're calling for?
So the Science Table released kind of their own brief about recommendations that they think will work to kind of curb this terrible third wave that we're in now. They called it like the way forward. And this is a group of, independent scientists, researchers, and doctors. And basically what they were saying will work are, closing non-essential workplaces, like truly all the ones that don't need to be open, paying workers to stay home when they're sick or they need time to get vaccinated, or even if they're exposed to COVID and they need to just isolate. Speeding up the vaccination of essential workers who live in hotspots, restricting travel within the province from, hot zones to places that aren't dealing with as much COVID, and then just focusing on public health guidance that works and allowing people to stay connected. So that means saying that people can spend time outdoors if they're distanced and they're wearing masks and they're making sure their hands are clean and things like that. And then they also go into what won't work. And they're saying policies that, harm racialized or marginalized vulnerable populations. And I think that's a direct response to the policing powers that were announced on Friday to kind of be able to stop and ask people randomly on the street where they're going and even ticket them, which basically is kind of bringing back carding. But that was walked back over the weekend after police forces said that they didn't want to do it, and also kind of a public outcry about that. And then also the Science Table is saying, that policies that discourage safe outdoor activity, like, safe recreation distanced, and ones that will hurt kids or people who don't have access to green space or parks are not going to work. So that's also kind of, I think, directed at this restriction that the government announced on Friday around closing things like golf and tennis and skate parks. They did reopen playgrounds over the weekend after people were really upset about that, but there are still restrictions aimed at outdoor space.
Right. Well, this is almost a pared down version of what the Science Table says. Here are the big things that we think will help, essentially. Kenyon?
Yeah, that's exactly right. This is like their summary. Peter Uni, the scientific director of the COVID-19 Science Advisory Table, said he likened this to a roadmap, a very easy to use, easy to understand document that says, okay, if we really want to beat this virus, here are the 6 major broad areas that we need to focus on and the 6 things we have to do. And here are the things that we shouldn't be doing. And if we follow it, we should be able to get ourselves out of this pandemic. Now, of course, I think some of this depends partly on how quickly we can vaccinate people. That will be a huge player in this. And then right now, I don't know if it's realistic to set a goal for when we can vaccinate people by, because we just don't know what supply is going to be like in the next several weeks.
Right. There's a lot of variables here that may not be up to, obviously, Ontario and not even up to Canada in some respects. Some of the measures the science table is recommending are being taken by the Ontario government. Most recently we saw that they are committing to a paid sick leave program. This comes after months of pressure by medical experts. Other measures, though, like May mentioned, like truly essential workplaces, allowing people to meet outside distanced. Those things right now, at this stage, are not being allowed. The Ontario government has consistently said that they are listening to science and they are making those decisions following that. But of course, many Ontarians are also asking, and that includes scientists who serve on this table, is the Ontario government actually following the advice of the medical experts that they say they do? The doctors that you interviewed for one of the stories, what do they think about the position that they're in and how the Ontario government has responded to some of this advice?
Yeah, so the government has consistently said that they are following the advice of scientists, and they have said that in response to us and also other reporters along the way, every step of the way. I think with this science table way forward, I think one of the reasons why they did it is because they wanted to get out kind of their vision, and as Kenyon said, their roadmap for what will work. And I know that on Friday, after the government announced, their new public health measures, there was a lot of blowback from members of the science table. Some of their quotes, if you remember, ran on the front page of the Star on Saturday. They were saying things like, this is not targeting the really vulnerable essential workers. And those are a lot of the people that the doctors and nurses are anecdotally seeing filling up ICUs and their family members, that they need to, have sick days and time to isolate. They've said they're kind of considering that, or they're hinting at that. But yeah, I also talked to an emergency room physician in Toronto that was saying he'd like to see just more workplace safety measures in general, and, making sure that people have proper masks or N95 masks at work sites, and that they have to mask like all the time. And then at the same time, there were some members of the science table talking about how the outdoor regulations don't really seem grounded in science, because as far as we know, the consensus seems to be that outside is less risky, not zero risk, but a lot less risk than inside. So I think this is why you're seeing in this brief that they're really talking about giving people the ability to have safe recreation outside rather than taking that away.
Just going back to, are they following the science? I think in some respects they are, and in other respects they're not. And this is sort of the sentiment I think that we've gotten from numerous people we've interviewed. So for example, the early advice was, we see all these deaths and cases in long-term care. We have to vaccinate long-term care residents first. And we did that. And in this third wave, long-term care residents have been relatively protected because we focused on vaccinating them right away. And then there was some recommendations that, okay, well, if we're vaccinating sort of older crowds, we should, continue that trend and kind of move down the list of decades. So, if you're in your 80s or your 70s and your 60s and your 50s, and that's what we've been doing. Then I think it was in February, we started to hear recommendations. And I think the Star's reporting even talked about risky postal codes in areas, where there's large concentrations of essential workers, that this is the next sort of group we should be really focusing on, because these are the people who have to go to work, have to work in congregate settings like factories and meat processing plants and warehouses and things. That was in February, and it's now April. So the government is now saying it is trying to target essential workers. But I think one of the complaints has been that it took them quite a while to kind of come around to that. And we saw in early April, Doug Ford, came out and said, okay, we've got this list of hotspots that we're going to start vaccinating in. But that was, basically 2 months after we heard that we should be focusing on essential workers. So they are now doing that. The other thing that I think scientists, at least those that I've spoken to, continue to point out as something that the government hasn't done, and that is, when we say we're going to only keep open essential businesses, what are we talking about? Because the definition of essential business in the policies and the legislation is very broad. You could interpret it in numerous different ways.
We'll be right back. It feels like a bit of deja vu, because I remember having this conversation back last April where we were like trying to figure out what counts as essential. And, that discussion was still there. And it seems to be coming up again in a worsening third wave of a reassessment of, is this essential? Do we absolutely need this right now? So it seems like that conversation is coming around again.
It is, and it's still unsolved. I heard Dr. Williams the other day. Somebody asked him about, like what would it take to close truly non-essential businesses? And the answer he gave was kind of, we have to sort of look at what is essential and what is not. Well, obviously, but that doesn't answer the question is what is truly essential and what is not, and who's making that judgment. And then if we actually come up with a definition, how do you enforce that? How do you make sure places close? Right? It's not an easy task. I think that's important to say. Like the definitions, depending on your beliefs and who you are and where you work, you could get into an argument with people for ages, right?
And I think it's important to think about, workers that might be in a precarious situation or just might not be comfortable standing up to their boss when a boss is saying no, we all have to go into the office, or no, we all have to go in even though there was a COVID outbreak here last week or something. It can be really hard to push back against that, So I think that's why the science table is recommending that, really we need to make sure that only the truly essential workplaces are open. I've heard anecdotally even stories about people working in finance who are still going into the office saying we need to be here and we need to have that environment conducive to business or whatever it is.
Show FaceTime, yeah.
Exactly. So I definitely think that's happening. And I think it's worth noting too that both Peel Public Health and Toronto Public Health on Tuesday introduced a new regulation to say that workplaces with 5 or more COVID cases will be forced to shut down for 10 days. So I think that's also a way for the local public health units to kind of get at this issue of workplaces and workplace transmission, which definitely we know is a big source of transmission in the third wave.
Mm-hmm. Workplace is obviously a big center of focus right now. There's also a lot of talk about hotspots, as you mentioned, and that takes us into some of the specifics of the reporting you've both been doing. The Science Advisory Table, again, has given the province a list of COVID hotspots that they say needs more attention, that needs prioritization in terms of vaccinations. What did your reporting find in how the Ontario government applied that information?
About a month ago, and probably actually more than a month ago, the Science Table provided the provincial government with a list of postal codes, or what we call FSAs, forward sortation areas, which is the first 3 characters on your postal code, that they said these are high priority areas for vaccination because these are areas that have a high risk of transmission. And this was sent to the government, but there were several interesting changes that were made. Maybe I should back up a bit and just explain. The Science Table, in order to delineate or provide a measure of risk, they assign a number to each postal code. So a 1 is the most riskiest, a 10 being the least risky. If it's a 1, it's a highly risky place. You really want to get vaccines in there. If it's a 2, it's the same. If it's a 3, it's the same. And as you go down the list, it becomes less of a priority. So what we saw was that when we get to the 3s, there were 5 number 3 postal codes. So, moderate risk, still pretty risky, that were taken off the recommendations from the Science Table. And instead, 8 other postal codes were inserted into the government's list that were from areas of much lower risk. So we're talking about areas that would have, say, an assigned value of a 4 to a 7. So much lower risky areas were inserted while higher risk areas were taken out. So May and I have been trying to figure out why that was done and who did it and how. And we haven't been able to really figure that out. We haven't been able to get an answer from the government that's straight. They've told us that many different factors were taken into account in their lists, including input from the Science Table, including input from the vaccination task force, demographics, hospitalizations, all sorts of different metrics. But what we're curious about is how are these 5 that were taken out, these 5 specific areas, how were they determined to be taken out? Why those 5?
Especially if they were deemed as higher risk.
Correct. Who said take these 5 out? Why would they take them out? And then 8 were inserted that were from lower risk areas. And our question is, well, someone must have decided that these 8 should be added to the list. And why those ones? It's important to say here that we're talking about thousands of postal codes. So someone picked these 8 out of the huge list. It doesn't seem random.
Is there something in common with the 8th, though?
Again, the story is just asking the question and going to the government and asking them why these were chosen. And we found that 1 was in Ottawa. I think 5 were in York in places like Richmond Hill, Thornhill, Markham, and 2 were in Windsor. There's been some other reporting by colleagues at the CBC and the Ottawa Citizen that were pointing out that some of the lower risk postal code areas were PC ridings. We did find that of the 8, I think it was 5 out of the 8 were PC ridings, but it's fair to say that most ridings in the province are PC, especially in, I guess, the GTA area. So yeah, basically, we just thought that would be relevant information for readers, but the story is just asking the question of why these postal codes were selected and others were dropped off. And out of all the postal codes in the province, why these specific 8 ones were picked to be on the list. And I think it's worth noting too that the Auditor General now will be investigating the vaccine rollout and how the hotspots were selected as part of her duties. She was asked to do that by Andrea Horvath, the leader of the NDP, the opposition.
Going back towards the Science Advisory Table and then putting out this playbook, obviously, the Ontario government will make certain decisions that they deem to be the right ones. In an advisor role, by releasing this playbook, do you think that they're trying to be more transparent to Ontarians? Are they trying to make their advice more clear to people? Is that the effort here, you think?
I think so. In recent days, we've seen some public frustration from Science Table members, whether that's on Twitter or, even to the media. I know members have considered resigning even.
Here's that clip that May is referring to. It's Dr. Peter Uni, Scientific Director for the Science Advisory Table, talking to CBC on April 17th.
I don't know. To be honest, yesterday was one of the darkest days in my professional career and also personally. We need to do that differently. A lot of people implored me not to step down because we need to move on and we just need to make the best out of it.
So I think what they're trying to do, and I don't want to speak for them, but what I see this document doing is just getting their position on the record very clearly and really increasing that transparency so that the public can see what they recommend based on their independent expertise and years of study and PhDs and medical degrees and all of that. And then the public can take it in a very digestible, clear, simple, short document and compare that with the regulations that were actually recommended by the government on Friday and going forward.
Kenyon?
It's like a position paper in a way. This is where we stand based on our expertise. Here are the 6 broad areas that we need to focus on. Here are the 3 areas we shouldn't be focusing on. And it's presented in a very easy to understand, short document. It's only 2 pages, less than 2 pages, and it lays everything out in very clear language. And I think because of the confusion that developed on Friday when the government brought in, a lot of these restrictions that a lot of people feel were overreaching, some of which have been walked back. There was some confusion about, okay, so what are we doing here? Like, what is going on? And I think this was an attempt to kind of say, here is what we're saying we need to do. It's an easy to understand, short document. This is it. And we need to do this. And I think that's part of their role, is to look at the data and look at what's happening and make recommendations. So that's what they've done here. And I think it's a useful document. It's very helpful because if you're not a reporter or you're not a scientist, it's easily digestible by any member of the public. It's a short document and it says, here's what we have to do. And I think that's why they released it, which is sort of to say, here's what we need to do going forward. It's very straightforward. And this is our position as our role as advisors.
Kenyon, May, thank you for your reporting and for joining the podcast.
Thank you so much.
Thanks.
And that is May Warren and Kenyon Wallace, 2 Toronto Star reporters covering COVID and more recently reporting on the Ontario Science Advisory Table. That's it for today. Thanks for listening. This Matters is hosted and produced by me, Adrian Chung, Saba Aitazaz, and Raju Muthar. Produced and mixed by Sean Pattinen, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.